this long part is the spongy urethra, which is the longest part. Okay. So shortest part is the membranous urethra and longest is the spongy urethra. You can see the length here. Okay. Now the last thing, the epithelial lining of the urethra. 3 different epithelial lining is in male urethra. First part, this makes sense. You will understand why 3 epithelial lining. This is the very first part of urethra. This part has transitional epithelial lining. Why? Because urinary bladder has transitional. Remember that? So what happens from urinary bladder? It continues a little bit inside the first part of the urethra. Does it make sense? It continues from the bladder like this. Continues into the first part of the urethra. That is transitional. And most part is ciliated columnar. Ciliated columnar, pseudostratified ciliated columnar. So cilia are there to push the mucus out. Only the end part here is stratified squamous, because the end part has more chance to get what? Friction. Remember, I mentioned many times, right? The area has more chance to get friction, stratified squamous. Is it clear? So first part is what? Transitional, comes from the bladder. And last part is stratified squamous, chance of friction or getting exposed to outside air is more, right? So that is stratified squamous. And most of the part is the middle part, which is pseudostratified column. Okay? Okay, so that is the bladder and urethra. A few clinical conditions, nephritis, 2 types, acute, chronic. Chronic nephritis can cause kidney failure. Okay. Production of urine. If the kidney fails and the production of urine stops, that is called anuria. A means absence. So normal amount of urine production is, we say 1 liter to 2 liter. Some places you will see 800 milliliter to 2000 milliliter. That means 0.8 liter to 2 liter. Okay, that is normal amount of urine production. Now, anuria, if the production of urine is less than 100 milliliter per day, that is considered as no urine production. Oliguria. If the production of urine significantly is reduced significantly, very small amount of urine formation, less than 400 milliliter per day, that will be considered as oliguria. Pyuria, dead white blood cells or pus in urine, is called pyuria. Dead white blood cells, which is pus, or dead tissue, dead cell in the urine. Hematuria. Have you heard these words? Anybody? Blood in urine. In this case, we see intact red blood cell, hematuria, intact RBC in the urine. Okay. If you see broken red blood cell, that means hemoglobin comes out, right, from the red blood cell. That is called hemoglobinuria. Hemoglobinuria. Hemoglobin in the blood. Proteinuria. We use these terms a lot. Proteinuria, protein in urine. If only specific type of protein is present, for example, albumin. Albumin is one type of protein, you know that, right? Plasma protein. Albumin, globulin, fibrinogen. So if you see only albumin, that is albuminuria. Make sense? If you see other proteins too, proteinuria. Okay? So those are the terms we use to indicate the production of urine, abnormal production of urine. So if you understand how the kidneys work, this is very important. And when we learn the diseases, and things will see get so easy to understand. If you know the mechanism, how the kidney works, okay, understanding the diseases, it becomes what? Very easy. This is happening here, this is happening here, right? So if this one is blocked, this one doesn't function, then what can happen? Can easily. So anatomy and physiology is very important. Physiology of kidney is very important to understand the kidney diseases and the consequences. Okay. So let's stop here today. Kind of.